Good morning, everyone. I am Dr.Smita Vats, and I welcome you all to a discussion on understanding polycystic ovarian syndrome, brought to you by MomPlus. So, polycystic ovarian syndrome is a multifactorial disorder and was described initially by Steen Leventhal in 1935. Nowadays, the incidence is so high that almost every fifth patient that a gynecologist sees in the OPD is that of polycystic ovarian syndrome. And it is important to understand this syndrome properly because it leads to a lot of menstrual problems, that is delayed periods, irregular periods, or sometimes if the periods start after 1.5 or 2 months, they may just go on, and you may need to take medication to stop them. And it is also a leading cause of infertility because of the presence of anovulation, that is absence of release of egg from the ovary. And the most important reason why you need to understand and sort of control polycystic ovarian syndrome right in the beginning is because of the long-term sequelae that it has. So any person who has polycystic ovarian syndrome is at a much higher risk of developing high blood pressure, diabetes, gestational hypertension, that is diabetes during pregnancy, heart disease, sleep apneas, and also endometrial cancer later on in life. Well, that brings us to the question, how does one find out whether you have polycystic ovarian syndrome or not? Well, there are a lot of signs and symptoms which are associated with it, and although all the symptoms or all the signs may not be present in one person, but even a presence of 2 or 3 of them should alert you to the possibility of the diagnosis and lead to an early investigation. There may be sometimes delayed or abnormal periods, that is, the periods may start more than 10 to 15 days later than what their expected date is, and sometimes they may just continue on and do not stop without taking medication. Or there may be presence of abnormal body hair on the face, on the chest, on the abdomen, on the thighs, or on the buttocks, etc. There may be scalp hair loss, that is maybe presence of male pattern baldness kind of a thing in the females. Or there may be excess of acne on the face or on the chest, on the shoulders, etc. There is also obesity and a high preponderance of infertility in the patients of polycystic ovarian syndrome. Well, PCOS is diagnosed when at least 2 out of the 3 criteria listed here are present in a person, and when all the other reasons which may be leading to the presence of these symptoms like thyroid disease or prolactin disorders or other endocrinological disorders have been excluded. So there may be menstrual irregularity, as we discussed before. There may be signs of hyperandrogenism, that is presence of excess male hormones in a female's body, which may lead to abnormal hair growth or acne or the other signs and symptoms of excess male hormones. And there may be a presence of polycystic ovaries on ultrasound, in which 12 or more follicles are found to be arranged peripherally on the boundaries of the ovaries, at least one of the ovaries, and the volume of the ovary is more than 10 centimeters square on ultrasound. So naturally, one of the commonest questions that all the patients of polycystic ovarian syndrome ask is, why does one develop polycystic ovarian syndrome? So unfortunately, the exact cause is unknown, but what we do know is that it has a lot of inherited as well as environmental factors which affect the manifestation of the disease. So a lot of studies have proven a genetic inheritance leading to defects of insulin action, obesity, or defects in hormone production and other features which lead to polycystic ovarian syndrome, as well as there are a lot of environmental factors which lead to manifestation of this disease in a person who is prone to developing it genetically. So these include the diet of a person, obesity, that is raised body mass index, stress, various environmental toxins, and all these things, a sedentary lifestyle and faulty dietary habits are primarily the reason for the preponderance of the disease in mainly urban population. In the rural population or in smaller cities, we don't have so much of existence of polycystic ovarian syndrome. That is primarily because of the kind of lifestyle, the physical activity, and the dietary habits that they have. Well, coming to the treatment options, according to the Royal College of Obstetricians and Gynecologists, the first line of treatment for PCOS should be lifestyle modification, which includes diet control. That is, you should be avoiding any high-calorie fried stuff like chips, pastries, pizzas, burgers, chocolates, basically all the good things, and focus more on fruits, vegetables, healthy, home-cooked, hygienic food. A weight loss of at least even 5% will lead to a lot of improvement in the symptoms of polycystic ovaries, and of course weight loss cannot be attained without regular exercise. So at least half an hour to 45 minutes of regular exercise, that is a moderate kind of exercise wherein you are a little breathless and you are sweating a little while you are exercising, should be done for at least 5 days a week, or if not every day. Then in some patients, of course, if there is a hormonal imbalance, then we do need to give certain hormonal medications to correct that imbalance, and these would include oral contraceptive pills or sometimes anti-androgenic medications. And in some people we do need to give metformin or other insulin sensitizing agents in order to keep the insulin resistance under control. In women who desire pregnancy and have polycystic ovarian syndrome, medications sometimes need to be given for induction of ovulation and to promote the chances of pregnancy. Such pregnancies, of course, need to be supported more by medications and need to be monitored more closely. And if all the other measures have failed, occasionally we do need to do a little bit of surgical intervention, and maybe like laparoscopic drilling or removal of a small part of the ovary in order to control the symptoms of polycystic ovaries. And there are a few features which need to be corrected only by cosmetic measures, like presence of excess facial or body hair. So the development of further hair can be prevented by medications and lifestyle changes, but the follicles which have already been recruited need to be treated by cosmetic measures like laser and other options, and of course these should be done in conjunction with your doctor. Well, to conclude, polycystic ovarian syndrome is a multifactorial disorder and needs to be addressed strongly and aggressively right in the beginning as soon as you come to know the diagnosis, primarily by lifestyle modification, and of course you may need to resort to medical options or surgical options as and when required occasionally in the lifetime, but try to depend more on your lifestyle modification for long-term control. Thank you for your attention. This is Dr. Smita Vats from Mom Plus.